COVID-19 has had a major impact on all facets of healthcare. Continuing our coverage of Donate Life Month, we want to welcome Dr. Brian Boyarsky, lead author of a fascinating COVID-19 vaccine study at Johns Hopkins School of Medicine. Thank you so much for joining us, Doctor.
Thank you.
So before we get into the study, I just wanted to ask you what you've witnessed in terms of eligibility of donation, procurement, recovery after transplantation in the era of COVID-19?
Well, thanks a lot for having me, and it's really a great question. So when it comes to organ donation, it's very important that the screening criteria are very strict to ensure that when it comes time to procure an organ from, say, someone who has died, that individual does not have COVID, so that way there's really no opportunity to transmit the COVID from the patient who has died to the recipient of the organ. So all hospitals really across the country and organ procurement organizations have very strict guidelines and protocols in place to ensure that COVID is not really being transmitted through donation.
Have donations and for recipients, has it been hampered at all because of COVID?
You know, initially back in March and April of 2020, when the world really shut down, the healthcare system on the whole was overburdened by everything that was going on. So initially what we found was that donation really went down in large part, particularly living donations. So living kidney donation and living liver donation, because a lot of the hospitals wanted to prepare for the worst. So really any elective operations were put on hold for the time being. But interestingly, what we've seen as the year progressed, a lot of hospitals across the country were able to adapt to the changes that had happened, and the transplant rates really bounced back over the course of the year.
That's incredible and life-saving for so many people. Tell us more about this study. It sounds fascinating. And how many months did it take you to at least come to your conclusion thus far?
Sure. So what we've done is, starting in December of 2020, as soon as the mRNA vaccines, so the Pfizer and Moderna vaccines, got their emergency use authorizations in the United States, we knew that there would be transplant recipients across the United States who would be vaccinated right away. The problem was that in the original vaccine trials, transplant recipients and other immunosuppressed people were excluded. So in general, the original vaccine trials pretty much only included healthy people with immunocompetent immune systems. So we knew that there would be a lot of transplant recipients across the United States who perhaps are healthcare workers who would have access to early vaccination. And we also knew that there are really two major questions that a lot of people have with respect to vaccination. One, is it safe? And two, is it effective? So for this particular study, what we did was we recruited transplant recipients from across the United States, largely using social media, and we looked to see how safe the vaccines were and were they effective.
Very interesting. What did the results mean for non-organ transplant recipients, so who are on immunosuppressive medications?
Sure. So let's first talk about what the results mean for the transplant recipients.
Okay.
So specifically what we did was we studied 436 transplant recipients who had access to early vaccination. And what we did was we looked at the antibody response to vaccination. And that's one glimpse into the greater immune response to vaccination. It's one of the more efficient ways we can study how effective someone's immune system is at generating an antibody response after the vaccine. What we saw in the original vaccine trial was that almost 100% of healthy people developed antibody responses after about 2 or 3 weeks after just the first dose. Now, what we found in this study was that only 17% of transplant recipients developed an antibody response to the first dose of the vaccine. And that was very surprising for us and worrisome as well, because these results can have real implications in that if the immune system is not generating an effective and a robust immune response to the vaccine, it certainly means that someone who is immunosuppressed, like a transplant recipient, could be at higher risk for getting the disease and a severe form of the disease after vaccination.
That's got to be so scary. So where is the study at this point? Are you going to continue the process, and are you still looking for people to participate?
Yeah, so at this point, we've recruited almost 4,000 transplant recipients across the United States who are very motivated and very interested in learning about how effective the vaccine is, particularly in transplant patients. And, we're just at the stage of analyzing data after the second dose, and we see a slightly improved response after the second dose. But I will say that the immune response is still blunted. Now, in other vaccines, we know that transplant recipients in general have a slightly blunted immune response to those vaccines, but the magnitude of the blunting of the immune response is what's surprising us with the mRNA vaccines. In addition to studying these questions in the transplant population, we're also looking at other immunosuppressed patients across the country. So people with autoimmune conditions, people with certain forms of cancer who either because of their underlying diseases or the medications that they take to help control their diseases, they might also be at higher risk for infection after getting the vaccine.
And that's why it's just so important for people to still wear the mask, still maintain social distancing, because you just never know the person next to you, that they could look healthy, but they could have this sensitive immune system. And, until we find that golden key, I think, we all will do much better if we just stay safe. I will look forward to learning more about your study as it continues to progress this year. Doctor, I want to thank you for joining us.
Thank you very much.
Thank you. We're back in 2 minutes.